I am Dr. Varghese, Head Minimal Access Surgery, GEM Hospital, Parvatani, Thrissur. I would like to talk about colorectal cancer today. The colorectal cancer is becoming common all over the world. In our part of the country also it is becoming very common. Our day-to-day practice, we see more patients with the colorectal cancer than any other cancer in the abdomen. So it is important, to make a early diagnosis because the results become much better if the cancer is diagnosed at the early stage. To diagnose the cancer at the early stage, the patients or the public should be aware of the symptoms or problems related to the cancer of the colon and the rectum, so that they can become suspicious if such problems take place and they can report to the doctor at the earliest. How do you suspect that one is having cancer or not? One of the most common symptom that can happen, bleeding per rectum. That is, they pass blood along with their stool. When that happens, usually we all think that it may be related to the piles or hemorrhoids. Most common cause is that. Occasionally it can be due to other causes like the cancer what we are talking today. But in piles, the bleeding will be bright red in color. It will be fresh color. In cancer of the colon or the rectum, it will be altered color, that will be either brownish or blackish in color. So whenever you are passing blood which is altered in color or blackish in color, you should be extra cautious, because it need not be the piles, and you should be immediately reporting to the doctor. One of the most common problem for cancer patients is passing mucus with the stool. The slimy material, if you notice passing along with the stool, you should be careful. It could be it could be related to a disease related to the colon or rectum. So in that case also, you should be reporting to the doctor at the earliest. There are other symptoms like weight loss or loss of appetite, and many other problems can be there. But the most common problems, what I said earlier, if you come across, then there should not be any hesitation for consulting the doctor, so that the doctor can make the necessary investigations and then decide whether you are suffering from cancer or not. So that way, probably we can make an early diagnosis. And these investigations I talked about, maybe a blood investigation or stool examination or an ultrasound examination or an endoscopy test done through the anal opening, that is called colonoscopy. In some situations we may require a CT scan or MRI scan. So all patients may not require all investigations. Then depending upon the clinical scenario, the number of investigations required or the order in which the investigations are required will be decided by the doctor. Most of the situations, by doing ultrasound examination or by colonoscopy, the diagnosis of the cancer of the colon or the rectum can be made, and the confirmation can be done by the biopsy taken during the endoscopy test. The staging can be done by a CT scan. Once the diagnosis of the cancer of the colon or the rectum is made, most of the situation, the treatment is by surgery. And the surgery is done by either by open method or by laparoscopic method. Both are good, both gives good results. Laparoscopy is done through keyhole incision, so it avoids big incisions altogether. The recovery after the surgery becomes faster, and the pain after the surgery will be less compared to that of open groove. The tumor removed during the surgery will be sent for the histopathological examination. Based on the report of the histopathological examination, the final stage of the disease is determined. And based on the stage, it is decided whether to do any further treatment like a chemotherapy or occasionally a radiotherapy. That if it is required, definitely the patient should be undergoing as advised by the doctor. And so once the treatment is completed, you may require a regular follow-up to the doctor. At times, the investigations or the tests required by the doctor need to be done to make sure that everything is okay. So it is very important in cancer related to the colon or the rectum to make the early diagnosis. And to make the early diagnosis, one should be aware of the problems related to this colon or rectum cancer. If you are suspicious, you should be reporting to an expert doctor or to a hospital which is dealing with such problems, so that the diagnosis can be made early. The detection of these cancers can be done early so that the treatment can be more effective, and if it is very early, even we can get a cure of the problem. Thank you.